Everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform. If my voice is audible to everyone, please put a message in the comment section. Thank you. Hello, everyone. I hope my voice is coming to everyone. And yes, okay, yeah, it is coming, I guess. In the Unacademy, we have something known as Plus subscription and something known as Iconic subscription. Let's start the class. आज मैं सुबह बहुत लेट उठा. Hello, Savan. Hello, Osama. Hello, Dr. Ifat. Good morning. I hope your health, everyone health is okay. In the Unacademy, most importantly, let's start. We have the All India mind-blowing mock test, which is happening on 26th of February, basically, and at 9 a.m. So I recommend everyone to participate in this test. It is free of cost. Enroll as fast as possible. Also on the Unacademy, we have this crack NEET PG combat I told you on Feb 19th. So जितने ज़्यादा हम test देंगे, the more we give the test, the more it will be amazing for us. The syllabus which will be covered will be orthopedics, obs, gynae, surgery, and pediatrics. So that's what the top rankers can win exciting rewards, and 10 lucky participants can win amazing gift vouchers. So amazing. I mean, you should participate. It's gonna be crazy. 19th Feb, 6 p.m. In the Unacademy, we have something known as Plus subscription and something known as Iconic subscription. In the Plus subscription, what do you get? You get access to all my live and recorded classes. You get to study from the best of the best educators all over the India. You get to compete in various live tests and quizzes. Then you can watch me on your iOS, on your laptop, on your iPad, everywhere. Okay, and our quick questions are amazing. This is the Plus subscription. In the Iconic subscription, you get the Unacademy platform and the Prep Ladder subscription. All the live batches, recorded classes, question banks, rapid revision, dream notes, everything you get on the Iconic subscription. That's it. And congratulations to our amazing FMG toppers who have worked so hard. And now you all, Savan, Osama, Ifat, now it's your turn to rock the stage. Okay. Every educator is amazing. Every educator has a very beautiful plan for the whole February. Join every educator's classes. It's gonna be good. If you're a newcomer, we have something known as Unacademy app, which you should download, because in that app we have some special amazing feature which is not there on this YouTube channel. We can ask a lot of MCQs poll over there. It is really good. You can ask me any doubt. All the lectures are recorded because all PDF files you get, whatever I write. So those are like मोती की तरह वो notes होंगे आपके लिए. So that's what, and I told you the NEET pages there on May 21st. So very less time is left. So we have NEET PG 2022 All Educator Revision Batch. In this one, we're gonna take the revision classes. Then I will give you time for the self-study. Then I will take a subject-wise grant test, and then we have a solution discussion. So everything we have what you need to get a rank one. That's it. We have made another batch that is NEET PG Ultra Fast Rapid Revision batch. Then we have NEET PG Previous Year Question batch. This is so important. Of course, everyone asks me कैसे पढ़ना है सर, important बता दो सर, कोई important topics बता दो. अरे भाई लास्ट 3 ईयर क्वेश्चन पेपर्स कर लो, वह बहुत इंपॉर्टेंट है वो. एंड वी हैव दिस इमेज बेस्ड क्वेश्चन बैच विच इज माय फेवरेट. आई ऑलवेज टेल लुक एट द इमेज एंड टेल द डायग्नोसिस, लुक एट द इमेज एंड टेल द डायग्नोसिस, एंड दैट्स हाउ यू शुड लर्न ऑल्सो. That's it. And for FMGs, we have Focus FMG December 2022 batch and a comprehensive batch. So it's everything is cool. This is the NEET PG Plus subscription. These are durations and prices. And after putting a discount coupon, like being an MBBS student, sometimes it's difficult to buy a pack. So we have this code over here. The code is Dr. Anand. If you use this code, it will be a little financially comfortable for you to take a pack. Okay. Only few days left. Take it as soon as possible. Let's start the beautiful journey. Today's topic of choice will be nothing but what today's topic of choice will be tracheoesophageal fistula. Before starting any amazing segment, we always have a motivating quote. And hello Savan Singh, hello Osama, hello Ifat, hello Deepa. So today's motivating quote is he has the most who is most content with the least. So very beautiful quote of Lord Buddha, which says he has the most who is most content with the least. जिंदगी जैसी है, जितनी है, जो भी है, उसमें खुश रहना सीखिए. अगर कुछ आए तो बहुत बढ़िया, ना आए तो और बढ़िया. Always have a thought of satisfaction in mind. Always have a peace inside your soul, that you are a peaceful soul. Tell yourself that you're a peaceful soul. You are a comfortable soul. You are a happy soul. You are a calm soul. You are a good soul. You are a strong soul. So he has the most who is most content with the least. So मेहनत करो, do hard work, do whatever you want to do, but at the same time don't be negative, don't be frustrated. I've seen people being very frustrated with life. Don't be negative, don't say negative stuff. I don't think so I can clear it. No, my friend, she is a topper, she could not clear the exam, how can I clear? मैंने तो सुना है कि 2-3 बार फेल होंगे उसके बाद ही एग्जाम क्लियर होता है, एक बारी में तो होता ही नहीं है. सो जब ये सब प्रथा आप अपने लिए बना लेंगे, when you make such dictums for yourself, then that only will happen. Positive attracts positive, negative will attract negative. If I ask you, will you clear the exam, you should say definitely, there's no doubt about it. If you say, sir, I hope I will clear, I really hope, sir, then I also hope it will clear, because surety, you also don't have surety, then how come your future will have surety? So very important, he has the most who is most content with the least. Today's topic of choice will be tracheoesophageal fistula. Tracheoesophageal fistula. This is a very cute photo of my patient, pediatrics by Dr. Anand. This is my cute baby patient. Yes, so everything will make sense at the end of journey. Okay, just work hard. Okay, let's start. So yes, let's start, everyone. The most common, so please, this topic is a very simple topic. If you are a newcomer, then fine. If you are someone who wants to revise with me, you have read this topic, so I have made the topic in the whole question answer format. So if you have already read this topic, can anyone tell me which is the most common congenital anomaly of the esophagus? Dr. Savan, bro, what do you think? Which is the most common congenital anomaly of the esophagus? So esophagus, same. The answer is nothing but tracheoesophageal fistula. ठीक है? Yes, exactly. So the most common congenital anomaly of the esophagus is nothing but esophageal atresia, and in that, out of that, more than 95% will be tracheoesophageal fistula. Now see, this is a very simple topic. अच्छा, oh, Savan says TOF, tetralogy of palate. टॉफ लिखा है तूने, टॉफ इधर आ, तू इधर आ जा, इस तरफ आ, इस कैमरे की इस तरफ आ बेटा, पहले मार खा लो, 2-3 थप्पड़ खाओ, उसके बाद जाओ वापस. है टॉफ, तुम्हारे घर की कहानी है, ये चल रही है. टॉफ कैसे होता है? TF, टेटनसो ट्रेकियो ईसोफेजियल फिस्टुला. ठीक है. सो यस, सो आई रिपीट अगेन अवॉइड क्रैमिंग एंड स्टार्ट अंडरस्टैंडिंग द कंसेप्ट. द मोस्ट कॉमन congenital means by birth anomaly, problem of the esophagus. This my food pipe, and then my this one first is our windpipe, and then is the food pipe. So of the esophagus is nothing but esophageal atresia. What is atresia? Atresia means abnormal narrowing. Atresia is abnormal narrowing, and that one, the most common problem I have is nothing but tracheoesophageal fistula. ठीक है, very good. Okay, tracheoesophageal fistula is divided into, it's a very important 5 marks MBBS topic, divided into classifications, features, diagnosis, treatment, and complications. Okay, so let's start the whole journey. Before we cramming, we should understand the concept. So Dr. Savan, we have Dr. Savan in our what do you call, on our YouTube channel, is one of our very good follower. Hanji, Dr. Savan, tell me one thing. So I would say, a 10 days old child, a 10 days old child, a 10 days old term baby, सब समझ के पढ़ना है. देखो, it's a very simple topic. 10 days old baby came to you in nursery. Okay, so Savan gave me a call. Savan saying, Anand sir, जो ये बच्चा एडमिट किया है मैंने, the baby who I have admitted, sir मेरे को ना tracheoesophageal fistula लग रहा है. And I was like, bro, how do you know? How do you feel it is को? So what is the meaning of that? Tracheo means trachea, and this is my esophagus. So tracheoesophageal fistula. What is fistula? Fistula is nothing but like an abnormal connection, right? Abnormal connection kind of a thing. So Dr. Savan, if some baby comes to you with tracheoesophageal fistula, how will the patient present, bro? डॉक्टर सावन से, सर मेरे को ना TF का पेशेंट लग रहा है सर, मैं पक्का बता रहा हूँ. मैंने कहा तेरे को कैसे पता कि TF का पेशेंट है? सो एनीवन, सावन, इफ़त, व्हाट डू यू थिंक? ओसामा, कैसे हम एक बच्चा कैसे प्रेजेंट करेगा? मतलब फॉरगेट अबाउट लर्निंग दिस टॉपिक, लाइक इन जनरल, अगर किसी का ट्रेकिया और ईसोफेगस कनेक्टेड है, तो क्या वो नॉर्मल बैठा होगा, आराम से चाय पी रहा होगा, सावन की तरह मोटा होगा, मोमोज खा रहा होगा? नहीं. तो कैसा होगा? एग्जैक्टली, वेरी गुड. वो बच्चे को क्या होगा? डिस्ट्रेस. येस और नो, होगा कि नहीं होगा? यू हैव टू यूज योर ब्रेन्स. कोई रटने वाली बात नहीं. इट्स अ वेरी इजी कंफर्टेबल टॉपिक. विल द बेबी विल हैव डिस्ट्रेस? डेफिनेटली द बेबी विल have distress. And most importantly, I have a very important question here, that if the it will like if the baby is having tracheoesophageal fistula, will you have any positive history in the mother? Will the mother be a case of oligohydramnios, or mother will be a case of polyhydramnios? What do you think? What gynae people will say, what if the baby is a case of tracheoesophageal fistula, normally what associated problem do you think? The mother will be a case of oligohydramnios, or mother will be a case of polyhydramnios? Very good. So Albert is very right. Savan is also very right. Polyhydramnios, more than 4 liter like polyhydram. Why if the gynae people says Dr. Anand, Dr. Savan mother को बहुत लाइकर था, बहुत लाइकर, too much लाइकर was there Dr. Savan. So why your mind should think कि अरे बेबी में एक बार मैं चेक कर लूँ कहीं tracheoesophageal fistula तो नहीं है. Now very good, Ifat is right. So how does the liker form in anyone? How this oligohydramnios and polyhydramnios means like too much of liker or no liker, right? How the liker is formed? How it is formed? सावन लाइकर कैसे बनता है, कौन बताएगा? How does the liker form? Do we have any connection? How does the liker form? Very good, very good. So सावन सुसु करता है तो yes, baby's urine. So liker इसे समझ के पढ़ना है please everyone. We have a lot of newcomers also over here. So yes, exactly. So how the liker is formed? By the baby's urine. Baby passing susu, baby swelling susu. In the mummy's tummy, in the fetal circulation, liker is formed by the baby's urine. Baby passes urine, baby swallow urine, passes urine, swallow urine, passes urine, swallow urine. So this susu which is passing and that susu only is swallowing, this is what happens in the fetal circulation, and that is how the liquor is formed. In a case of polyhydramnios, baby is passing susu very well. Baby is passing susu very well, but he's not able to swallow the urine. He's not able to swallow the urine. That was too much of susu outside, and he's not able to swallow the urine. Why he's not able to swallow the urine? Because he has tracheoesophageal fistula, that food pipe which he is trying to put, no, whatever that food pipe, no, once I'll change the color. So that whatever he is trying to put inside the food pipe, it is not going. It is not going. It is getting blocked here, and that thing is going into the windpipe. Yes or no? Do we agree with this point? Yes or no? There is a esophagus, there is a trachea, there is a fistula. Whatever you give me milk, whatever my secretions, my normal secretions are there of the mouth, will they go down to the esophagus? No, it's a blind pouch. They will not go. Where they will go? They will go from this fistula, they might go to the trachea. Yes or no? Is this line true or is this line false? Can the secretions go to trachea? Savan, what do you think? इस बात सच है कि जा ही नहीं सकते secretions trachea में? Definitely जा सकते हैं. So when there is so much of secretion in my mouth which is not able to go down, it is going towards my what you call the of my on the lungs. So most importantly, can the patient have drooling of saliva? Yes or no? Drooling of saliva. Can the patient have frothing of secretions? Can the patient have frothing of secretions? Very important. Yes or no? So yes, the patient will have distress. The patient will have lot of distress. Distress means fast breathing. What is the normal RR of a newborn? Savan, Osama. What is the normal RR of the newborn? Yes, Savan, very true. You're right. In type C, the secretions can't go to trachea. Yeah, that's also very true. But in some cases, what I'm trying to say is that what I'm trying to make you understand is in some cases there would be some problem, right? We have various types of TF which we're going to study now. So कुछ में trachea में जा सकता है bro, कुछ में नहीं जा सकता है. Savan, I'm so proud of you. You are there abroad and studying so well. Very good. ठीक है? Yes, very good. Sujit is right and Savan is right. So 40 to 60 cycles per minute is the normal RR of a newborn. 40 to 60 per minute. So how can we appreciate? I told Dr. Savan that 10 दिन का बच्चा है, term baby है, nursery में आया है. I think it's a case of tracheoesophageal fistula. I said, bro, how do you know? Sir, the patient is having distress. Sir, the patient is having drooling of saliva. Sir, but the patient is having frothing of secretions. Sir, the patient is sick. sick बच्चा होगा, and the mother, then the gynae people says that the mother was a case of polyhydramnios. So can we come to a conclusion? Can we make a PG entrance question here? Can we connect? Always remember, whenever you're reading one topic, imagine you are hypothetically sitting inside that topic. You are at the center. There is a tracheoesophageal fistula. You can see everything. वो मैट्रिक्स में होता है ना कि सब दिखता है, मेरे को सब दिख रहा है. वो लूसी मूवी में होता है ना कि आई कैन सी एनी एवरीथिंग. आई कैन सी दिस ट्रेकिया, आई कैन सी द फिस्टुला, आई कैन सी ड्रूलिंग, distress, frothing, baby is very sick, so everything I can see, and I'm sitting in the center so that I can see everything. Okay, let's continue further. Yes, now this is a very important question. I'll give you a 2 rupees chocolate. Chocolate 2 rupees तो आती नहीं है. Okay, I'll give you a 2 rupees toffee. Okay, who wants 2 rupees toffee? सब अमीर है, 2 rupees तो कोई लेगा भी नहीं. हाँ जी, what is the name of the classification? If you have read this topic already, then you are here only for revision. What is the name of the classification for tracheoesophageal fistula? What is the name of classification? हाँ जी, Dr. Sama Osama. डॉक्टर सावन एंड ओसामा. हाँ जी, इफ़त, व्हाट इज द, डू वी हैव दिस, क्या कोई नाम होता है क्लासिफिकेशन ऑफ व्हाट यू कॉल्ड उसका ट्रेकियो ईसोफेजियल फिस्टुला का? डॉक्टर सावन, व्हाट डू यू थिंक? ओसामा, इफ़त, मुंह को जुबान खोलो, ऐसा करके खोलो. हाँ जी, एनीवन. एग्जैक्टली, ब्यूटिफुल आंसर बाय सावन. वेरी गुड डॉक्टर सावन, वेरी गुड. ठीक है, द नेम ऑफ द क्लासिफिकेशन फॉर tracheoesophageal fistula is gross classification. Very important. The name of the classification is gross classification. That's another exam question. Okay, and also in the previous, just now I told you, right? If the mother is a case of polyhydramnios, you should rule out tracheoesophageal fistula in the child. And also just now Osama has told us, if the mother is a case of oligohydramnios, Dr. Anand, liker tha hi nahi. Dr. Anand, there was no liker. Bacha aaya, baby came out, no liker. So means no liker means no susu, right? No liker means no susu or no urine. So how does the urine form in a baby? Urine basically form from the kidneys, right? Yes or no? So if the baby is not having susu, if the mother is a case of oligohydramnios, you should rule out renal agenesis in the child. If the baby has born, Dr. Anand, there was no urine at all, there was no liquor at all, baby is fine, okay, but there is no liquor at all, means renal age, बच्चे का किडनी खराब तो नहीं है, देखना पड़ेगा. You have to see whether the baby's kidneys are working or not, and for that if the mother is a case of oligohydramnios, renal agenesis should be ruled out. And please get a ultrasound KUB done. Kidney, ureter, bladder, get a ultrasound done. ठीक है, done. Yes, no idea, it's fine. This you got it right. You got it right. अब समझ में आ गया आपको? If the mother is a case of oligohydramnios, means baby not passing urine, baby urine not forming, means kidney some problem is there. So you should rule out renal agenesis. बच्चा जो हमारे hospital में, in our hospital, when we get some cases like that, we definitely get a ultrasound, kidney, ureter, bladder done, and you get the whole solution. Has everyone understood this much? Okay, yes or no? It's a very sweet and small batch. ऐसे बढ़िया पढ़ाई करेंगे कि भाई बेस्ट ऑफ द बेस्ट स्टूडेंट्स वी शुड बी. ओके, विदाउट एनी डाउट. एक शब्द एग्जाम क्वेश्चन है. आई होप यू आर गेटिंग इट. सावन समझ में आ रहा है? सावन, ओसामा, सुजीत, इफ़त, एल्बर्ट, आई होप यू आर एबल टू गेट अंडरस्टैंड दिस टॉपिक. दीपा, समझ में आ गया? पुट अ लाइक बटन if you understood. Put a yes button. Fine. Let's move further. The various classification of what you call the gross classification for tracheoesophageal fistula. हाँ जी, ओसामा ने पहले ही बता दिया है. ब्यूटीफुल ओसामा हमारा. यस, देखो अब ये बहुत इंपॉर्टेंट स्लाइड है, बहुत इंपॉर्टेंट स्लाइड है. These are the various types of tracheoesophageal fistula. ठीक है, this is my trachea and this is my esophagus. Okay, trachea and this is my esophagus, right? Now समझने वाली बात है. By one we will try to dissect the topic little. Yes, beautiful. Now, what are the various types of tracheoesophageal fistula? We have 5 types: A, B, C, D, and E. Okay, we have 5 types. We have 5 types of tracheoesophageal fistula. PG entrance question number 1. Which is the most commonest type? Of tracheoesophageal fistula? Anyone? Yes, already Osama has told. Remember, we need to remember the topic CAD, CAD. We need to remember the mnemonic CAD. Type C, the most common type of tracheoesophageal fistula is type C. The second most commonest type of tracheoesophageal fistula is type A, and the least commonest type of tracheoesophageal fistula is nothing but type D. At least these three words are very, very important. Very good, Albert. Very good. So type C, type A, and the least common is nothing but type D. ठीक है, type C तो हमेशा पूछते हैं, ठीक है. We need to understand in the type A. Now listen very carefully. It's like a simple maths. समझने वाली बात है, कुछ नहीं. Look at the image and tell it. So in the type A, what can we appreciate? Number one, can we appreciate esophageal atresia without TEF? Yes or no? Is this word true or is this line false? It is definitely true. We have a esophageal atresia without tracheoesophageal fistula. Yes or no? Very good. Yes, very good. And it is the second most commonest. Is this line true? Is this line false? Definitely ये बात भी सच है कि ये second most common है. And will you see, now very important, will you see, very important, yeah, will you see gas under diaphragm? Will you see the gas, not under, gas in the abdomen? Will you see the gas in the abdomen in a case of type A? The answer is no, because there is no connection. No, for having a gas in my tummy, there should be some connection with the trachea. समझ में आ गई इतनी बात? Very good. ठीक है, very very good, very good. Yes. ब्यूटीफुल. सो समझने वाली बात है, इसमें अच्छे से पढ़ना है. बहुत हल्का टॉपिक है ये. इट्स अ वेरी लाइट एंड कंफर्टेबल टॉपिक. सो वी विल स्टडी इन अ वेरी सिंपल एंड स्मार्ट वे एंड फिनिश इट ऑफ, एंड लॉट ऑफ क्वेश्चंस आर देयर. सो आई विल रिपीट अगेन. वी हैव टाइप ए. इन टाइप ए देयर इज esophageal. Revise here only and finish it off. Once you close the book or we close this video, everything should be inside the brain. It should not be inside the book, inside the notebook. यहाँ होना चाहिए, ठीक है. टाइप ए में क्या होता है? Have an imaginary picture. Will you have esophageal atresia? Yes. Without TEF? Yes. Is it second most common? Yes. Do you see gas in the abdomen? No. Done. That is type A. In type B, we have this one. Type B, what you call the tracheoesophageal fistula. And after type B, the important one which comes is nothing but type C. Now type C is very important. Why? Number one, type C is the most common. That is one thing. Type C. Now type C, what is this one? What is the how does it look like? So can we appreciate this line? It says proximal esophageal atresia with distal TEF. ये एग्जाम में क्वेश्चन आता है. ओके, व्हाट इज द मीनिंग ऑफ टाइप सी? व्हाट इज टाइप सी? हो क्या रहा है? सो ये यहाँ ये सी बना हुआ है यहाँ पे. सो देर इज अ proximal. कैन वी सी दैट? इज दिस इज द esophagus, right? So there is a proximal esophageal atresia and with the distal tracheoesophageal fistula. Yes or no? Very, ये याद रखना है. It is important. This came in exam. What is the meaning of type C? So proximal esophageal atresia. Tell your mind and your heart and inside your brain, the image imprinted should be there in the brain कि भैया proximal esophageal atresia होगा और नीचे type C बोला है, C. So distal TEF will be there. And will you see gas in the abdomen? Yes or no? The answer is yes. You will see gas in the abdomen. ठीक है, very good दाशु, very good इफ़त. ठीक है, समझ में आ गया. So type A, type B, type C. Then what happens in type D? Type D also is very simple. Type D also same thing, only that there is in type D what is happening? I made this connection. So proximal and distal TEF. Proximal and distal TEF is there. Naturally, can we appreciate this point? In this one, there was only distal TEF. In type C, there was only distal TEF, whereas in the type D, there is proximal as well as there is distal TEF. It is the least common one. And again, will you see gas in the abdomen? Definitely there is a connection. You will see gas in the abdomen. Yeah, very good, Albert. So again, can we appreciate in the type C only distal TEF? So distal में C. So type C कहते हैं. Type D, most importantly, there is proximal as well as distal TEF, and you will see gas in the abdomen. It is the least common. ठीक है, I hope we are getting a little connection over here. Type A, type B, type C, type D, and last one is type E. What is type TE? They say usually it is kind of a H type, kind of a H type. So isolated TEF, it's a single isolated tracheoesophageal fistula, and yes, you will see gas. In the abdomen. ठीक है, isolated single, मतलब क्या ना, कई जगह तो क्या होता है, देखो, are we understanding? Yes or no? In the type C, there was distal TEF. In the type D, there was proximal as well as distal TEF. And in the type E, there was isolated isolated TEF. ये शब्द बहुत important हैं. These words, my dear friends, let's finish it up and let's revise it million times so that it imprints in our mind. In type C there is type C की form में होता है. In type C there is distal TEF. In type D there is proximal as well as distal TEF, and in type E there is only one single isolated TEF, and you will see gas in the abdomen. You will see gas in the abdomen. खड़ाक के आगे पीछे. ठीक है, समझ में आ गई इतनी कहानी? Has everyone understood this much? Please say a comment box yes, or please put a like button on the video. I hope you are able to get it. ये बहुत अच्छा टॉपिक है, बहुत बढ़िया तरीके से कवर हो रहा है. We are fortunate we are studying this topic. Everyone understanding? ओसामा, दाशु, इफ़त, सावन, एल्बर्ट, समझ में आ रहा है ठीक ठाक तरीके से? Okay, beautiful. That's nice. That's wonderful. Okay. Yes, very good. Okay. हाँ जी, डॉक्टर सावन सिंह. Dr. Savan Singh, you told me कि मैंने बोला I asked you that is sir you told me sir एक बच्चा एडमिट किया sir, I feel it's a case of tracheoesophageal fistula. I said how do you know it's a case of tracheoesophageal fistula? You said me कहाँ चला गया, 1 second, yeah. Okay, you said me sir the baby was having distress, the baby was having fast breathing, the baby was having frothing of secretions, the baby was having drooling of saliva, the baby was looking little sick, and the mother gave a history that the mother is a case of polyhydramnios, right? This much I assume, this much we covered, and this much you told me, सावन told me कि सर ऐसे ऐसे बच्चा आया, मेरे को लगा शायद इसको TEF है, right? So next important point here we understand is how do you confirm or how do you diagnose? क्या इतना काफ़ी है? मतलब anyone, anything else? How do you confirm this, that whether there is what you called tracheoesophageal fistula? There is a connection. How do you confirm? Very good. Savan has come with a very beautiful answer. So you will get a X-ray done. If you will get a X-ray done, very important, we need to understand in the X-ray this one. Can we appreciate this point? Can we what can we see here at this part? ये क्या कोई पाइप दिख रही है यहाँ पे? कुछ पाइप जैसा क्या है ये क्या हो रहा है पाइप का? वेरी इंपॉर्टेंट इमेज बेस्ड क्वेश्चन, प्लीज पे अटेंशन. एग्जैक्टली, देयर इज क्वाइलिंग ऑफ द नेजोगैस्ट्रिक ट्यूब. एनजी ट्यूब होता है ना, एनजी ट्यूब, नेजोगैस्ट्रिक एक ट्यूब होता है बेबी में जो नाक से होते हुए टमी तक जाता है. नेजोगैस्ट्रिक tube. Okay, so once I put a tube, will I be able to pass it wonderfully in the tummy? No, right? There is a blind pouch, there is a obstruction, there is a atresia, could be any type, but there is a problem for sure. So I will not be able to pass coiling. I would say what are the options I can say? I can say failure to pass. I can say failure to pass a nasogastric tube. I can say when I passed the nasogastric tube, there was coiling. Can we appreciate this coiling? Yes or no? अंधा भी देख ले, ऑस्कर को बुलाऊंगा वो भी देख लेगा इसको. So yes, so coiling of the nasogastric tube. Okay, so how do you confirm it? सर मैंने NG tube डाला एंड मैंने डाला फोर्सफुली और मैंने उसको एक वो माइक्रोपोर से उसको फिक्स कर दिया. एंड बिकॉज नेचुरली इफ यू डोंट पुट इट विल कम आउट. नो, इट कांट गो ओनली, देयर इज नथिंग इनसाइड, बट यू पुट इट लिटिल इनसाइड एंड पुट अ माइक्रोपोर ताकि वो वही रुक जाए. गेट एन एक्सरे डन, वंडरफुली यू विल सी दिस coiling of the NG tube. Okay, very good. Yes, that's it. And one more video also we have, this one also. See this also, ये रहा. ध्यान से अगर आप देखेंगे, ये यहाँ ये ट्यूब डाली है मैंने, ये इधर जा रही है और ये कॉइलिंग है. वेरी इंपॉर्टेंट. ठीक है, टाइप सी दिस वन. एंड विल यू सी गैस इन द एब्डोमेन? यस, डेफिनेटली. इन टाइप सी, रिमेंबर, इन टाइप सी वी हैव डन दैट. यू विल सी देयर, सो देयर विल बी गैस इन द एब्डोमेन बिकॉज दिस अ कनेक्शन. नो, दिस इज द कनेक्शन, राइट? सो देयर विल बी गैस इन द एब्डोमेन. होएगी ना ओसामा? होएगी कि नहीं होएगी ओसामा? होएगी ना गैस इन द एब्डोमेन? हाँ जी, ठीक है. एंड विच वन, इन विच कंडीशन देयर विल बी नो गैस इन द एब्डोमेन? विच TF? अगर हम एक बार रिवाइज करें, इन टाइप ए विल देयर अ गैस इन द एब्डोमेन? नो, देयर इज नो गैस इन द एब्डोमेन. इन टाइप बी देयर इज गैस इन एब्डोमेन? नो, देयर इज नो गैस इन एब्डोमेन. इन टाइप सी, yes, there is gas in abdomen. In type D also, yes, there is gas in abdomen. And what you called in the last type, there is distal gas, there will be gas in the abdomen. So what can we appreciate? In type A and in type B there is no gas in the abdomen, बाकी जगह होगी. टाइप A और B में नहीं होगी. ठीक है, वेरी गुड, perfect. Okay, very good, nice. Let's go move further. This was the patient admitted to us in a case of TEF actually. And incidents, okay, कितने बच्चों में होता है? Yes, exactly. Udit is right. No connection, no gas. As simple as that. Very good, Udit. Very smart. इंसिडेंट्स कितने बच्चों में कॉमन है? अगर 100 बच्चे आते हैं तो 100 बेबी डिलीवर होते हैं, तो हाउ मेनी बेबीज डू यू थिंक? यू आर रिवाइजिंग दिस टॉपिक, राइट? यू हैव रेड दिस टॉपिक, so tell me the answer. Out of 100 babies, how many babies do you think are in our hospital comes with tracheoesophageal fistula? So the answer is 1 in 4,000. 1 in 4,000. If there are 4,000 deliveries, one baby will have TEF. And luckily, I have seen enough of TEF in the last 1 year only. From last 1 year, I'm posted in NICU. So in nursery, I only see newborn babies, and मैंने काफ़ी देख लिए हैं. So out of 4,000, 1 in 4,000 live birth. Okay, next. Yes, we have done this. That tracheoesophageal fistula is associated with polyhydramnios or oligohydramnios. The answer is polyhydramnios, right? Due to inability of the fetus to swallow the amniotic fluid. And also in some cases also you will see, single umbilical artery. In some cases you can see single umbilical artery also. Can we, what is this, spotter? ये क्या है ये? विच इज़ वेरी ब्यूटीफुल स्पॉट है, इतना सुंदर है. व्हाट इज दिस? क्या दिख रहा है इसमें ओसामा? क्या है ये? सो ये तो हो गया हमारा अम्बिलिकल स्टम्प. अम्बिलिकल, आई वुड से नॉट स्टम्प, अम्बिलिकल क्लैम्प. क्लैम्प ये वाइट वाला दिख रहा है, यस और नो? ये वाइट वाला तो हो गया अम्बिलिकल क्लैम्प. इसमें हाउ मेनी आर्टरी, हाउ मेनी वेन्स डू वी हैव इन इन अम्बिलिकल कॉर्ड? सो एवरीवन नोज वी हैव 2 आर्टरी and we have 1 vein, right? 2 artery and 1 vein. I think everyone knows about it. Yes, exactly. Ibza, you will rock. Motivation, you want motivation? आ जाओ, अभी motivation तो हो के ही रहेगा, जो मर्जी हो जाए. That's what you will rock it. So peace begins when the expectation ends. Peace begins when the expectation ends. Stop expecting about the results. Stop expecting about how much you have done. Just have a peace in the mind. Keep working hard. Keep working hard. See, don't worry. It is always, don't worry on the outcome. Don't worry on the outcome. You worry on the process. Like, don't worry. You don't focus on the outcome. होगा कि नहीं होगा. इतने सारे सब्जेक्ट हैं, ऐसे कैसे हो जाएगा? मेरे को तो याद ही नहीं हो रहा. आई एम नॉट एबल टू रिमेंबर. आई एम नॉट एबल टू गेट इट. माई फ्रेंड ऑल्सो, शी इज द टॉपर. शी इज फॉरगेटिंग. भाई, आई वॉज तो सो एवरेज. सो डोंट वरी ऑन द आउटकम, वरी ऑन द प्रोसेस. फोकस ऑन द प्रोसेस. ये टॉपिक अच्छे से कर लो, माइनर सब्जेक्ट्स अच्छे से कर लो, 1 लाइनर्स रिवाइज अच्छे से कर लो, एमसीक्यूज अच्छे से कर लो. सो किसी तरह कर लो. फोकस ऑन द प्रोसेस, डोंट फोकस ऑन द आउटकम. क्यों? बिकॉज बूंद से सागर बनता है. बूंद से ही सागर बनता है. बूंद अच्छी होगी, सागर अपने आप अच्छा बनेगा. ठीक है? सो डोंट वरी, हो जाएगा. चिल. ठीक है? लाइफ इज रियली शॉर्ट. ओके, एंड मोस्ट इंपॉर्टेंटली, येस, वी हैव डन दैट. वी हैव 2 आर्टरी एंड 1 वेन. सो ये देखो, इट्स सच अ ब्यूटिफुल. दिस इज 1 artery, this is the second artery, 2 artery, and this one is the vein. So 2 artery and 1 vein. Very beautiful picture we have here of the umbilical cord. Okay, also at the same time, yes, neonate presents with what? At Sawan already has told us कि बच्चा कैसे आएगा. Neonate will the baby will have frothing? Yes or no? Imagine your mind is the most beautiful thing God can gift you. So have an imaginary thought. बच्चा आया है, कैसे होगा? The baby might have frothing. Then will the baby will have excessive drooling of saliva or coughing? So important question, very good question. A newborn baby while admission having coughing with feeds. Coughing, जितना feed दे, बच्चा खांसी कर रहा है. Such an important simple word. That's how the examiner will ask you. See, your eyes can't see what your brain doesn't know. Your eyes can't see what your brain doesn't know. That's why we have this theory topic discussion, so that your brain knows कि ऐसा भी examiner पूछ सकता है कि a baby was coughing while feeding, coughing with feeds. So you must rule out what you called yes, but you must rule out TEF. Yes, exporting says if like then give heart, pink, purple, golden or magenta. Yes bro, you're right. And also, will the baby will have cyanosis? क्या बच्चा नीला पड़ सकता है? Definitely the baby can have cyanosis. And will the baby will have distress? Yes, the baby will have distress. So I assume that there is nothing to cram here. We have understood the topic, we have understood the subject, the content. We are not cramming. The baby will have frothing, the baby will have drooling of saliva, coughing while feeding, cyanosis, distress. Undoubtedly, yes, the baby will do it. Yes, very true. And yeah, yes, now this is the PG entrance question number 9. Which type of TEF presents later with recurrent pneumonia due to aspiration? Very good question. Let's see if you can answer. Savan, Osama, Dashu, Kalpana Lodhi, and our dear exportin Ashutosh. So, what do you think? Which type of tracheoesophageal fistula presents later with recurrent pneumonias due to aspiration? तो ये किस केस में यूजुअली हो सकता है? Whenever there is a connection, right? Tracheoesophageal fistula, there is a connection. So whatever that from the food pipe, my secretions are going in my windpipe, and I'm having recurrent pneumonia, recurrent aspiration. Exactly, Dashu and Osama is very right. The type H1, the last one which I told you, type H and N presents later with recurrent pneumonia due to aspiration. It's a important सावन सिंह अच्छा A B D E. So हाँ मतलब वो तो चलो कनेक्शन किसी में भी हो सकता है, एग्री विद यू, बट यूजली टाइप H. क्यों सर ऐसा ही क्यों? क्योंकि वो आइसोलेटेड TF होता है. अगर हमने पढ़ा हो यहाँ पे दिस वन टाइप बेसिकली टाइप E जो होता है जिसे हम टाइप H या फिर टाइप N कहते हैं, जिसमें आइसोलेटेड TF है, एक सिंगल प्रॉपर एक आइसोलेटेड फिस्टुला बना हुआ है, उसमें देयर इज अ गैस इन एब्डोमेन, एंड यहाँ क्योंकि सिक्रीशंस आर going into my trachea, so I can have recurrent aspirations, recurrent pneumonias like that. Okay, it's a very nice. So remember, okay, type C will have a, which is the most common is type C. It will have a distal TEF. In type D it will have a proximal TEF, and type E it will have a isolated TEF, तो वो ज़्यादा strong होता है, and it can lead to recurrent aspirations and pneumonia. Okay, that's done. Okay, this is a very good question. Tracheoesophageal fistula is associated with which anomalies? Yes, PG entrance question number 10. This last week we had a patient of TF in our nursery, and this HOD had asked me this question कि अगर बच्चे को TF हो गया है तो क्या क्या सोचोगे? What else you will rule out? Do you want to rule out any other thing? It's a very good question. What else will you rule out if the patient is having tracheoesophageal fistula? Yes, exactly. Very good. The answer is Osama says VSD, Ibza says Vectral. Yes, very good. So the answer is you will rule out everything. You will rule out CVS anomalies, you will rule out Vectral anomalies, you will rule out any hypospadias, and you will rule out undescended testes. So CVS anomalies, Vectral anomalies, hypospadias, and what you call undescended testes. What is hypospadias? What is epispadias? Anyone? What is, have you heard the name? What is hypospadias and what is epispadias? What is the meaning of that? Any random guesses? What is hypospadias and what is epispadias? कौन बताएगा? What is hypospadias? Anyone? What is hypospadias? कहाँ यूरिन का धार किधर जाता है उसके अंदर? What is hypospadias? Who will tell me? What do you think? Anyone? हाँ जी, who will tell me किस में जाता है, किस में प्रॉब्लम होती है? यूरिन का धार नीचे जाता है, ऊपर जाता है, कहाँ जाता है? एनीवन? Urethral opening above is exactly, yes. So yeah, if this is the penis, then normally here we have the normal urinary stream. In hypospadias the stream will be at the down part. In epispadias the stream will be above the normal glans penis. Yes, exactly. So this will be hypospadias and this will be epispadias. Like I have a video, like I can't show you now, but we have a very nice patient video showing what you called hypospadias and epispadias. एक डिफेक्ट था ये, पीडियाट्रिक सर्जरी रेफरेंस कराना होता है इसके अंदर, ठीक है. अच्छा, वेक्ट्रल, कैन वी रिवाइज वेक्ट्रल एनोमली? वेक्ट्रल एनोमली, दे हैड 2 PG क्वेश्चंस इन वेक्ट्रल एनोमलीज. व्हाट इज वी से क्या होता है? कैन एनीवन टेल मी फास्ट? सावन, ओसामा, इब्जा, उदित, जल्दी खत्म करते हैं. 5 more minutes and this topic is over. Vectral anomalies, full form क्या होता है वेक्ट्रल का? V से क्या आता है? वेरी गुड, V से आता है वर्टिब्रल, राइट? वर्टिब्रल एनोमली. यस. A for anorectal anomalies. Very good. Yes. Yeah, very true. So vertebral defects, A for anal या anorectal anal anomalies, and C for cardiac. Yes or no? Cardiac. Vectral. T for tracheoesophageal. This was the PG question. Star mark. The PG question was in vectral anomaly, what is T stands for? T stands for tracheoesophageal anomalies. Vectral. E for esophageal. So you can say T for tracheal and E for esophageal, and R for renal and L for limb. R, very important. R for renal and L for limb. Very good, Albert. Very good, Osama, Dashu, Deepti. That the people who are answering have a very strong chances you will get very good rank. So vertebral, anal, cardiac, tracheoesophageal, renal, or radial also you can say, and limb anomalies. Limb anomalies. This was the PG question. In vectral anomalies, what is T stands for? The answer is tracheal anomalies or tracheoesophageal anomalies. Okay, very good. Next question. X-ray chest and abdomen will show what? So already very beautifully we have covered X-ray chest, nothing but X-ray chest and abdomen is done with the red rubber catheter passed per oral. So see, now listen very carefully. Now extra knowledge you should know. One second. So extra knowledge you should have that either you can pass a nasogastric tube. Sometimes the book says, OP Gahi 9th edition says, okay, instead of passing a nasogastric tube, the nasogastric tube is little kinky, little, it can kink by itself also sometimes and can give you a false reading. So you can say red rubber catheter. Red rubber catheter is better, it's firm. Red rubber catheter is firm. So if that is, you pass per orally or per nasally, so coiling of the rubber catheter is seen, or you can say failure of the passing of nasogastric tube or orogastric tube. Okay, I have a question for Dashu. Dashu, red rubber catheter after passing, if I confirm, like I passed the red rubber catheter, I secured it with micropore with a tape, and then I took an X-ray. There was coiling. I got it. Okay, fine. ये बच्चे को it's confirmed TEF. If I have to discard the red rubber catheter, where I should discard? Should I discard in the red bag? Should I discard in the yellow bag? Should I discard in the blue bag? Anyone? What do you think? Osama, Tashu, Savan, Albert, Deepti, where should I discard the red rubber catheter? कहाँ discard होना चाहिए? Kalpana Lodhi, very good. Kalpana has told the red best answer. The answer is red. The answer is you will discard is nothing but in the red. Okay, very good. So yes, you will discard in the red. Okay, I have gloves in my hand. Where should I discard my gloves? Anyone? Gloves कहाँ discard करते हैं? The gloves also very good in the red. Okay, I have a catheter, like okay, catheter. Okay, I have a what you called Euro bag. I have a Euro bag. Adult patient है, उसका Euro bag है, तो मुझे वो where I can discard that one. Anyone? Yes, exactly. Euro bag also goes into red. So all plastics they go into red. Even cannula ka, you have this IV cannula, no? In the IV cannula you have the needle and you have the stellate. Like you have this plastic wala stellate which we push inside. So that plastic also goes into red. So Euro bag, catheter, kind of what you call gloves, all those things basically go into red. Okay, yes, done. This part is done. Okay, how do you diagnose TEF? Done. That is of course done by X-ray. I will diagnose by clinical examination. I'll diagnose, and coiled tube at the atrectic end. मतलब coiled tube at the end जहाँ पे atresia है, right? And gas in the abdomen, of course, you see in type CDE. Yeah, exactly. So that's what, and that's it that you should know. And where do you see gas in the abdomen? We have done that already. Gas in the abdomen, we know that in type A, no gas in abdomen. Type B, no gas in abdomen. In type C, type D, type E, you will see gas in the abdomen. Yes, you will see gas in the abdomen. That is also very beautiful. We have covered. Okay, and so end part. So end part, it says, yeah, what is the treatment? What is the treatment for the tracheoesophageal fistula? See, everyone knows it has to have a surgical repair. अब भगवान तो आएंगे नहीं जोड़ने के लिए, so it has to have a surgical repair, right? So distance between the what you called both ends. See that if there is a two blind ends, and if the distance between these ends is less than 3 centimeter, if the distance between both the ends is less than 3 centimeter, you will do a surgical repair with end-to-end anastomosis. You will do a surgical repair with end-to-end anastomosis. जोड़ दोगे दोनों के end को, you will make them connected. So surgical repair with end-to-end anastomosis of the esophagus if the defect is less than 3 centimeter. अगर दोनों में दूरियां less than 3 centimeter है तो ठीक है. And if the gap is more, then what do you want to do? Anyone? I'll not tell you. If the gap is more, तब क्या करेंगे? If the gap is more than 3 centimeter, Savan, what will you do? क्या करना है? ऑपरेशन नहीं करना फिर? क्या बेटर? क्या शेख जहूर, what do you think? What's the better answer? See, if the gap is two blind ends, if the gap is less than 3 centimeter, do a surgical repair and end-to-end anastomosis. And the gap, what do you call? मच्छर आने शुरू हो गए. मच्छर घूमते हैं ऐसे जैसे उन्हीं का घर है. हम गेस्ट हैं यहाँ पे. आराम से धीरे धीरे घूमेंगे, रिलैक्स होके. ठीक है, हाँ जी. So yes, if the gap is more, this is the bad prognostic sign for surgery. Double star mark, need PG question number 13, which is a bad prognostic sign. The answer is if the gap between the two ends, between the two blind ends is more than 3 centimeter, it is the bad prognostic sign. It's an exam question. तो क्या करेंगे? Gastrostomy is done and esophageal repair by condo conduits, like connecting the whole thing with stomach or jejunum. So gastrostomy and esophageal repair by making another opening by conduit. Okay, so that's what. So can we appreciate one thing? If the gap is less than 3 centimeter, quietly you do a surgical repair and end to end jod do, end to end anastomosis. But if the gap is more, then you have to literally open it. Gastrostomy opening you have to do, and you have to repair proper connected by the esophageal repair by the conduit. Okay, that you should know. Next important point, complication. What are the complication a baby can have? Like this, we are happily finishing this topic. What are the complication? अगर मैंने अब if मैंने end to end anastomosis कर दिया, there was a blind pouch and then I did, ये हो गया यहाँ पे end to end anastomosis, मैंने surgery कर दी. What is the complication? कुछ हो सकता है इसमें? कोई rupture, कोई leak, कोई hemorrhage, is there any problem? Yeah, very good, very good. Ifat and Albert are so right. Number one, of course, anastomosis can leak. Again, a star mark. Very important. NEET PG question number 15. Which is the earliest complication? Which is the earliest complication of tracheo, of the repair for tracheoesophageal fistula? The answer is earliest complication is leak. जो तुमने end to end anastomosis बनाया है वो leak हो सकता है. It is as simple as that. And later it can come to stricture. Again, the most, see this, these two are very smart question. Which is the earliest complication? Which is the most common complication? So the again tell your brain inside your mind. Okay, the अर्लीस्ट कॉम्प्लिकेशन के वो लीक हो सकता है, और मोस्ट कॉमन कॉम्प्लिकेशन के वो ऑटोमेटिकली फिर दोबारा बंद हो सकता है, स्ट्रक्चर बन सकता है उसका. ठीक है, सो आई रिपीट अगेन. वेरी गुड. सो दाशु इज राइट, एल्बर्ट इज राइट, सावन इज राइट, दीप्ति, ओसामा, कल्पना, वेरी गुड, वेरी गुड, वेरी गुड. ठीक है, सो यस एग्जैक्टली. सो मोस्ट कॉमन कॉम्प्लिकेशन स्ट्रक्चर कैन हैपन, अर्लीस्ट कॉम्प्लिकेशन एंड लीक कैन हैपन. या यू कैन से लेट कॉम्प्लिकेशन ऑल्सो स्ट्रक्चर. या दैट्स ट्रू. एंड अदर कॉम्प्लिकेशंस आर GERD and Barrett esophagus. These are the other complications. Okay, that's it. Treatment is over. Yeah, and also now this part also, this is good one. If you have to refer the patient, see, if you have to refer the patient, like last week I got a patient in the nursery of TEF and we had to refer the patient to RML or AIMS hospital for the surgical management. Okay, because we don't have pediatric surgery here. So if you have to refer the patient, तो surgery तो पता है मेरे को, surgery करते हैं and all that. Like, do we have any precautionary measure we can take it? That's last exam question. Do we have any precautionary measure? बच्चे को drooling हो रहा है, बच्चे को frothing हो रहा है, बच्चे को dribbling हो रहा है, baby is coughing after feeds. Like, do we have, like, if today night at 9 p.m. the patient has come to me, tomorrow morning 8 a.m. I have to refer the patient. अब इस पूरी रात बच्चा क्या करेगा? The whole night, do we, what can I prevent pneumonia? How to prevent pneumonia? क्या करूँगा? कैसे कैसे करते हैं? What do you think? Do you want to give IV fluids to this baby? Yes or no? Of course you have to give IV fluids. Airway, breathing, circulation. ये ABC तो बोल ही दिया, बिना बात के कोई पूछे तो बता ही दिया करो ABC, है ना? So airway, breathing, circulation is important. IV fluids is so important. भाई बच्चा तो NPO हो जाएगा ना. What is NPO? NPO क्या होता है? Nil per oral. होगा कि नहीं करोगे बच्चे को? नील, बच्चे को अगर दोगे तो बच्चा तो एस्पिरेट कर जाएगा. इफ यू गिव द बेबी फीड और समथिंग, द बेबी विल एस्पिरेट, ही विल एक्सपायर वेरी फास्ट. सो यू कीप द बेबी नील पर ओरल, you give IV fluids, airway, breathing, circulation you'll maintain. And also very important, these babies, I remember, thoda sa, this is the plain bed, then little inclined, little upright position, like a 15 or around 30 to 45 degree. थोड़ा उठा के रखोगे naturally, because you know सारे secretions बाहर नहीं आएंगे. Little upright position you will keep the baby. And very very important, you will keep a orogastric tube and put a slow suction device attached to it. This is very important. This is the exam question. क्योंकि secretions आ रहे हैं ना, secretions आ रहे हैं बेबी को. So once secretions अगर बच्चे को आ रहे हैं तो थोड़ा तो upright कर दो थोड़ा सा. और एक orogastric, oro means mouth, orogastric, one pipe you put, like a suction pipe you can say that, and connect that pipe with a suction device. Slow suction device, not very high suction, very slow suction, जो help, so that the secretion which are building up, which is natural, so they are getting suctioned out. Exactly, to prevent the aspiration, to prevent the complication, to prevent the pneumonia. So upright position, OG tube, orogastric tube inside, and put a slow suction device attached to it. That you should know. Okay, and IV fluids, of course, you have told. And antibiotic, yeah, that's good one. No one said about antibiotics. Do you want to give in antibiotics? Yes or no? किसी ने दिमाग नहीं लगाया, किसी ने नहीं बोला कि शायद एंटीबायोटिक देना पड़ जाएगा. So the baby having this problem, I assume, right? He can have aspiration, he can have pneumonia, so he can have sepsis. Yes or no? He can have sepsis. Yes or no? Do you remember we have something known as early onset sepsis and something known as late onset sepsis? डॉक्टर सावन क्या होता है ये? और अगर नहीं बताया तो देख तेरा मैंने क्या करना है. वहाँ उधर यूक्रेन में आके तेरे को मारूंगा मैं. हाँ बताओ. हाँ जी. व्हाट इज अर्ली ऑनसेट सेप्सिस एंड व्हाट इज लेट ऑनसेट सेप्सिस? का नाम सुना है आपने? गलती से कोई पीजी की कोई आप में से कोई पीजी की तैयारी कर रहा है? अच्छा सारे कर रहे हो? ओहो हो, मेरे को तो याद ही नहीं था. हाँ जी. तो क्या होता है जरा बताएंगे थोड़ा सा. व्हाट इज अर्ली ऑनसेट सेप्सिस एंड व्हाट इज लेट ऑनसेट सेप्सिस? एनीवन? हाँ. वेरी गुड. एनीवन? वेरी गुड. सो अर्ली ऑनसेट सब क्या होता है मैं तो नहीं बता रहा, जो करना है कर लो. मुझे आता ही नहीं, मेरे को भी नहीं आता. मैं भी भूल गया. आई ऑल्सो, अब आई डोंट नो, पढ़ा तो था यार, याद नहीं आ रहा. एनीवन? एनीवन क्या होता है? हाँ वेरी गुड. सो अर्ली ऑनसेट सेप्सिस, अ बेबी कम्स टू मी विद सेप्सिस within 72 hours of life. Very good, Savan. A baby comes to me with sepsis within 72 hours of life is known as early onset sepsis. A baby comes to me after 72 hours of life or after 3 days of life is late onset sepsis. So what is the cause, Savan? Like what are the risk factors associated? A 2 hour old baby came with sepsis. A 3 hours old baby came with sepsis. प्रॉब्लम कहाँ पे है? वेयर इज द प्रॉब्लम? वेयर इज द प्रॉब्लम एंड व्हाट आर द रिस्क फैक्टर्स एसोसिएटेड? एनीवन? इन द अर्ली ऑनसेट सेप्सिस व्हाट आर द रिस्क फैक्टर्स एसोसिएटेड? कुछ है कोई कनेक्शन? एक बच्चा 2 घंटे में आ रहा है, एक बच्चा 20 दिन का बच्चा सेप्सिस में आ रहा है. लाइक डू वी हैव अ डीमार्केशन पॉइंट और डू वी हैव सम काइंड ऑफ डीमार्केशन? एनीवन? एनीवन? कहाँ से आ रहा है? मैं तो बताने नहीं वाला. वी हैव डन दिस टॉपिक वेरी ब्यूटिफुली. इफ यू आर अ न्यू कमर, वी हैव फ्री videos of Dr. Anand's pediatric lecture on Unacademy app and over here before it gets logged, before it goes to private, and then you tell me, ask me later, sir please discount coupon दिला दो. उसके पहले भैया पढ़ लो, काम आएगा तुम्हारी. मेरे को तो अच्छे से आता है. Exactly. My question is where is the infection? A 2 hours old baby came to me. You said, Anand sir, मेरे को early onset sepsis लग रहा है. So, Anand sir, I feel a 2 hour old baby having fever and this and that. I think it's early onset sepsis. Then I was asking you, ये आया कहाँ से? Where that infection came from? What are the risk factors? So the risk factor, do we remember? Yes or no? The risk factors are very important. 2M, 2L, and 2D. M for maternal fever. So maternal genital tract, yes or no? मम्मी से आया और कहाँ से आएगा? Exactly. So M for maternal fever, M for meconium stained. Okay. L for low birth weight, L for leaking per vagina for more than 24 hours. D for दाई handling, बच्चा दाई ने पैदा किया था. Another D is difficult resuscitation. Then single unsterile vaginal examination or more than three sterile vaginal examination. And in सबका जो बाप है सबसे बड़ा, foul smelling liquor. Foul smelling liquor is the single most important indication to start antibiotic. It's an exam question. Normally more than two risk factors are there. Normally if there are more than 2 risk factors, then you plan to start antibiotic in neonatal sepsis. But if you get a single factor of the foul smelling liquor or chorioamnionitis, then that is a single indicator enough to start the antibiotics. These all are the risk factors for the early onset sepsis. Early onset sepsis in the beginning 3 days of life or 72 hours of life. Baby coming to me with sepsis is known as early onset sepsis. Or why it is having sepsis? Because of the maternal genital tract. मम्मी से आया उसको. So maternal fever, meconium stained, low birth weight, leaking per vagina for more than 24 hours, daai handling, difficult resuscitation, single unsterile vaginal examination, more than 3 sterile vaginal examination, and foul smelling liquor. So these are the risk factors for the early onset sepsis. क्या ये कहीं गलती से कहीं पढ़ा है डॉक्टर सावन? ये कहीं पढ़ा है बाय मिस्टेक, कहीं किताबों में लिखा है? हैं ये जर्मन भाषा लिखी है मैंने या स्पेनिश लिखी है? लिखी तो इंग्लिश ही है, फिर जवाब क्यों नहीं दिया? फिर इधर आ, तो जवाब क्यों नहीं दिया डॉक्टर सावन, डॉक्टर इफत? जवाब, वेयर इज द आंसर? वेयर द नेशन वांट्स टू नो, वेयर इज द आंसर? जवाब क्यों नहीं है इस सवालों का? हाँ जी, जूली टिगड़ी। हाँ अच्छा, अब एक एक ऐसे धक्का मुक्की से लाइन मार रहे हो, उससे कुछ नहीं होने वाला, मैं ऐसे इंप्रेस नहीं हूँगा, ठीक है? ओके ठीक है, एंड दैट्स इट। एंड व्हाट यू कॉल्ड द लास्ट वन एंड दिस लेट ऑनसेट, समझ में आ गया इतना? यस और नो? हाँ अच्छा अच्छा, सावन कह रहे रशियन लिखी है। तू आजा बेटा, तू कब आ रहा है? व्हेन आर यू कमिंग टू दिल्ली? जून जुलाई नो? आजा, तो मैं मिलूंगा इन तेरे से, ठीक है? सो अर्ली ऑनसेट सेप्सिस में दिस इज व्हाट यू थिंक। एंड लास्ट क्वेश्चन, लेट ऑनसेट सेप्सिस, लेट ऑनसेट सेप्सिस वेयर इट इज कम? हाँ जी, हाँ ठीक है इफत, नो प्रॉब्लम, नो सॉरी, जस्ट वांटेड टू पुश यू। A late onset sepsis में what is the cause, what is the risk factor? Anyone? A 25 days old baby or 25 days old baby came to you with fever and sepsis and this and that. So what is तब क्या, तब when then you will think maternal genital tract is the problem. Then you will say sir maternal, माँ को बुखार होगा तो ही बच्चे को हो गया। तो मैं जान से मार दूंगा अगर ये जवाब भी दिया तो। हाँ जी, where is the, अच्छा नवाब नवाब, ओके वेरी गुड। तेरी इंग्लिश देखो, मैंने दिया था नवाब, नवाब, वेरी गुड, इट्स वेरी स्मार्ट जवाब, अच्छा हाँ जी। प्लीज़ कैन एनीवन टेल मी 25 डेज ओल्ड बेबी, ये पीजी क्वेश्चंस हैं प्लीज़। 25 डेज ओल्ड बेबी हैविंग सेप्सिस, सर आई थिंक मेरे को तो लेट ऑनसेट सेप्सिस लग रहा है, बिकॉज द लेट ऑनसेट सेप्सिस द बेबी कम्स आफ्टर 3 days एंड लेस देन 28 days. सो वेयर इज द प्रॉब्लम, वाई देर इज सेप्सिस? हैव यू हर्ड ऑफ पुअर कॉर्ड केयर? हैव यू हर्ड ऑफ पुअर कॉर्ड केयर? मदर को नहीं आता अम्बिलिकल कॉर्ड का वो क्लीन करना। हैव यू हर्ड ऑफ बॉटल फीडिंग? Have you heard of bottle feeding? Have you heard of maternal illiteracy? Have you heard of maternal illiteracy? Have you heard of overcrowding? घर पे 6 बच्चे हैं, नहीं, she doesn't know how to take care of the child. So poor cord care, सबसे बड़ी प्रॉब्लम poor cord care. Bottle feeding, what is in the bottle? Infection, infection, ऐसे बच्चों को ही sepsis होता है. Maternal illiteracy, ओवर क्राउडिंग, ये सब चीज़ें आर द मोस्ट इंपॉर्टेंट कॉजेज ऑफ द लेट ऑनसेट सेप्सिस। एंड यस, अच्छा, सो सावन सेज माई की पैड कीप ऑन डूइंग ऑटो करेक्शन एंड राइट उल्टी सीधी चीज़ें। मोटा है तू, मोटा, मुझे पता है तू मोटा है, ठीक है? सो दीज आर द पॉइंट्स ऑफ लेट ऑनसेट सेप्सिस। द गोल्ड स्टैंडर्ड इन्वेस्टिगेशन ऑफ चॉइस ऑफ नियोनेटल सेप्सिस इज ब्लड कल्चर एंड द ट्रीटमेंट is antibiotics. That finishes today's topic. Thank you so much everyone for this 1 hour of participation, and please remember, work hard, okay? Work hard, don't get stressed out. It's okay to get stressed out, it's okay to feel sometimes little negative, but work hard. Success will make noise one day. Success will make very big noise one day. इतनी शोर खुशियों का आएगा कि टाइम नहीं होगा तुम्हारे पास बस। So work hard, work hard, success will make noise one day, okay? Success definitely will make noise one day. Thank you so much for the participation everyone. Today now at 1:30 p.m, if anyone free, at 1:30 p.m I have taken a test. I have posted in other groups also. We have a test of pediatric neurology. We have a live test on pediatric neurology. I'll be asking you 100 MCQs on pediatric CNS topic, neurology. It's a revision class again on the Unacademy app. On the Unacademy app we have the test of the pediatric neurology, 100 MCQs, 1:30 today 1:30 in the Unacademy app. So download Unacademy, watch there my lecture. If you're someone who's watching my lecture after 3 days or 5 days or 10 days, still you download Unacademy, open Anand Bhatia, write my name, all the list of the topics are there, and pediatric neurology is one of the toughest topic, and but मोती की तरह हमने कवर किया हुआ है, अच्छे से हमने थियोरी क्लासेस की करी हुई हैं, and now that it's time for 200 MCQs. Thank you everyone for the participation. Yes. Dashu says sometimes negative thoughts can occur. Yes, it can occur sometimes, but it is our duty to divert our mind towards the positive. It is our duty to say hoga, definitely hoga. Divert your mind, listen to a music, take a hot water bath, relax yourself, watch a movie, talk to someone close to you, talk to a positive person. Once you talk to a positive person, your vision improves, your aura becomes something else. समटाइम वी फील इतना टफ है यार, कोई ऐसे बात कर लेता, लगता है अरे इतना भी टफ नहीं है, हो जाएगा, आसानी तो है, इतना भी टफ नहीं है, हम तो ज़्यादा ही सोच रहे थे करके. सो योर थॉट मैटर्स, योर ऑरा, योर पीपल, योर सराउंडिंग्स, इट ऑल डिपेंड्स ऑन दैट. और होते हो जाएगा। क्यों? क्योंकि बूंद से ही सागर बनता है। तो बूंद अच्छी होगी तो सागर अपने आप अच्छा बन जाएगा। ठीक है, थैंक यू एवरीवन फॉर द वंडरफुल पार्टिसिपेशन। ओके, जूली से सर सैम का वीडियो कहाँ पे है? नहीं, सैम की क्लास मैंने अभी ली ही नहीं है। सैम का मुझे क्लास लेना है। एक मैंने सैम पे 100 MCQs का टेस्ट बनाया है, उससे पहले एक थियोरी क्लास ले लेंगे और फिर हम सैम का भी एक वो कर लेंगे। सैम का मैंने वीडियो अभी रिकॉर्ड नहीं किया है। दिस वीक और मे बी अपकमिंग वीक, रिमाइंड मी जूली, विल हैव अ क्लास ऑन सैम। ठीक है, करने से होगा। आई वेरी राइट, ओसामा इज वेरी राइट। मैं डांस क्लास गया था, आई गो टू डांस क्लासेस ऑन वीकेंड्स। तो मैंने कहा ये तो हो ही नहीं रहा, हो ही नहीं रहा। एंड वंस आई एंटर्ड माई डांस क्लास, तो इतना बड़ा लिखा हुआ था, अजीब सा चार्ली चैपलिन बना हुआ था और लिखा हुआ था ऐसे ऐसे बैठा था चार्ली चैपलिन और ऊपर लिखा हुआ था करने से होगा। एंड आई वाज लाइक ओ माय गॉड शिट, ये तो सच में सही कह रहे, करने से ही होगा। मैं सपने देख रहा हूँ ऐसे कैसे हो जाएगा, ऐसे होएगा ही नहीं, होएगा ही नहीं। वचन करने से होगा, करोगे तो होगा, करने से होगा, कैसे होगा नहीं, बहुत सॉरी, करना कैसे है? करोगे तो होगा, करने से ही होगा, और कैसे होना है, करके करो और होगा। थैंक यू सो मच एवरीवन, हैव अ वंडरफुल इवनिंग अहेड एंड बी हैप्पी, लाइफ इज जस्ट वन। रिमेंबर, जिंदगी भगवान की एक बहुत ही महंगी गिफ्ट है, नंबर वन। नंबर टू, आओगे तो वेलकम, जाओगे तो भीड़ कम। ओके,